1. Hi there. This is the first of a couple of videos about evidence-based management. What I'm going to do is describe a little bit about the background to evidence-based management, which is derived from evidence-based medicine. I'm going to show you a couple of examples from evidence-based medicine and talk about the critically appraised topic report that you'll be doing at the end of the semester. And then in the second video, I'll be going through in a bit more detail the evidence-based management procedure. So evidence-based management is an idea it was kicking around for probably about a decade or so, but it's picked up momentum in the last few years, and our school was a pioneer in teaching it at university level. So we have postgraduate courses in evidence-based management in all of our master's degrees, and this course, although it's not called evidence-based management, has quite a strong evidence-based management flavour to it. It basically includes many of the things that I would be teaching you if the course were called evidence-based management. Not everything, but quite a lot. So evidence-based management had its origins in the fact that many doctors would learn how to carry out the practice of medicine as medical students and during their internships in hospitals and so on. But then they would, to a considerable extent, keep using the things they learnt as young men and women for the rest of their careers. And we found that a lot of medical practices were just outdated or were no longer evidence-based, and perhaps some of them were never evidence-based. So this movement emerged I think really from the 1970s onwards, but it culminated in the establishment of what are known as Cochrane centres. So these are centres around the world, sometimes associated with universities. So the one in China, for example, is associated with Fudan University. The one in Australia is based in Adelaide, and I, many years ago, in the 90s, was involved in getting government funding for it. So what we did in Australia was we funded these Cochrane centres, and I'll give you an example of what they do in a moment. And we introduced requirements for doctors to keep up to date with the research. We have various incentives and disincentives that are used by our central government to achieve that. Now, let me show you a Cochrane Centre. So this is their central website, and what I want you to notice here is that they have these things they call reviews, and so on the front page they highlight some. So they look like they're just recent reviews, and then they have a section where you can just browse by topic. So a Cochrane review is a very carefully carried out review of the literature on a particular clinical question, a question about whether something works or doesn't work. So let me show you an example of a review. So this is a Cochrane review, and what you'll see is it's about probiotics for treating eczema. So eczema is a pretty common condition. I'm sure there are people in the class who suffer from this, and many of our international students who come from climates with high humidity find themselves getting at least mild eczema for a while when they first arrive in Australia, because one of the aggregating features of the environment is low humidity. So the question here is whether probiotics are any good for treating eczema. So probiotics are, to simplify it, more or less kind of yogurt that you eat that is supposed to put helpful bacteria into your digestive system, into your gut. And so there's a theory around that probiotics are a great thing to treat eczema, and there's a fair bit of marketing around it. There are products that you can buy and so on. So what the authors of this study did was they went through the literature. So what you'll see, if you just look at the sections here, there's a bit of background which tells you what eczema is, what probiotics are, and so on. And it also tells you that this is updating a previous Cochrane review. So the objectives of this one is to assess the effect of probiotics on patients of all ages with eczema. So it's very clear about what sort of population of subjects it's interested in, and it tells you exactly what it's trying to find out. Then you have a section which tells you where they looked. So there's a whole paragraph there about the academic journals and databases that they searched, and then there's more stuff about how they selected the published research papers, and so on. It goes on and on. And then they give you a summary of the results, the author's conclusions, and then they have a plain language summary here. So what they do in the plain language summary, and this is sort of more like what I've been wanting you to do in your critically appraised topic, is they have a statement here which makes it very clear what their review question was. And then they tell you a little further down the key results. So basically what they found in this case was that currently available probiotics probably make little or no difference in reducing eczema symptoms such as itching and sleep loss. And they say that the evidence is of moderate quality. Now, I won't go through the whole thing, but one of the key things they found was that probably most of the studies they looked at were too short term. They were only for maybe a few months, and to get better evidence it might be desirable to have some longer term studies where people are studied for a year or two. So that's, as you can see, that's quite a long document. It contains then a table which summarizes all the research, the key research papers that they looked at. There's a whole lot of stuff about how they rated them, and then there's some more background information. These are very comprehensive documents. Their target audience for these is doctors, and the decision involved here, because we are talking about decisions here, the decision is about doctors is whether to recommend to patients that they should take probiotics for eczema treatment. There may also be a target here which is government regulators, who might want to regulate whether or not probiotics are advertised or sold as having some beneficial medical effect. I'll just quickly show you something else. This is not a Cochrane review. This is what they call a Cochrane clinical answer, and this is closer to what I'm going to be looking for from you. So this is pretty short and simple. So this one is about the effects of a very common painkiller, acetaminophen, which is also known as paracetamol, or the common brand name in Australia is Panadol. So the question is really about how good Panadol is for adults with tension type headaches. And this is an interesting one because it's fairly recent, 2019, and you might have thought, well, surely we know that by now. Surely what is probably the most commonly used medicine for headaches, at least in the West, surely we know whether it works or not. But it seems like there wasn't actually a comprehensive, up-to-date answer to that question. So what they did is they went to the literature, and they formulated a question, and they looked at the outcome. What they focused on was the outcome for headaches of people taking 1,000 milligrams, that's 1 gram of this medicine, that's the standard dose. What was the outcome after 2 to 4 hours? And so they give you various results here. So being pain-free was assessed at 1, 2 and 4 hours. More people were pain-free at 2 and 4 hours with paracetamol than with a placebo. Placebo would be an identical looking tablet but with no medicine in it. And there was no statistically significant difference between groups at 1 hour. So that's a useful bit of information. That tells you that with a tension headache, it could well take an hour to have a noticeable effect. That's something that's worth knowing. So you can see this is nowhere near as lengthy as the previous one. I'm now going to show you a third example. So this is an actual critically appraised topic. So these days, as a result of all this work we did in the 1990s, not just in Australia, in many countries, not just medical practitioners, not just doctors, but nurses and various other allied health professionals are trained to do critically appraised topics. It's part of their training. Now this one, I chose this one because this is actually although it's a medical one, it's the kind of critically appraised topic that a business might do if it was running, say, a chain of gyms, and it wanted to introduce an exercise program for elderly people who were having problems with their balance. So the question is, are lower limb strengthening exercises more effective than core strengthening exercises at improving balance in the elderly? Okay, so it's just asking for a comparison of two types of strengthening exercises, lower limb versus core strength. And the procedure here is exactly the same. So there's a clear statement of the question, of the population that you're interested in, people aged 65 plus, and the comparison between what they call the intervention lower limb strengthening and the comparison core strengthening, and the outcome they're interested in is balance. And then they tell you how many databases they searched, which ones they were, and here you see the search terms that they used. Now the reason they include that is so that somebody else can repeat that search in the future. It could be me marking your critically appraised topic, but in this case, 5 years from now, 10 years from now, someone might look at this and think, okay, I wonder if anything's changed. And so what they'd like to do is repeat the search and see if there's anything new. And then you have a table which contains what they thought was the most relevant and reliable evidence. And this is something you'll be doing in your critically appraised topic. And then at the end they have a little thing which is the bottom line and clinical relevance. So that is just a short statement of the results of their investigation, okay, whether they found compelling evidence one way or the other, and how relevant the evidence was to what they were interested in. And then the final bit is a list of references. In this case, that's a pretty short list of references. They evidently didn't find a huge amount of evidence. So one reason I've shown you this is it's pretty similar to what I'll be expecting you to do. We're going to be learning how to do this during the course, and you'll get some practice, and I'll be giving you a template. And this one I think was roughly 800 or 900 words, and I wouldn't expect yours to be much longer than that. It's going to depend on the topic and how much research is around, but I'm in that final piece of assessment, which is worth 20% in the week after teaching finishes. I don't want to impose a huge written assignment on you. The real idea is that you'll be working on this over the second half of the semester. Thank you.